Please welcome to the stage from the Clinton Foundation, Dr. Chelsea Clinton, from Aurora, the Humanitarian Initiative, Armine Afeyan, and from Pansy Hospital and Foundation, Dr. Denis Mukwege.
Well, thank you all for being with us, and certainly it's just a tremendous joy to share the stage with my dear friend Armine, and also someone I so deeply admire, Dr. Mukwege. So really, thank you both for being here. I wonder if we can start with you. I think many people may know the Aurora Prize and know the Aurora Humanitarian Initiative, but they may not know kind of the founding story. And I wonder, in this moment where I think we all really kind of need to be more in community with one another, more in authentic connection with one another, I think one of the ways we do that is through sharing our stories. So can you share the story of the catalyst for Aurora and kind of then ricochet us to the present and kind of what you're up to now?
Absolutely. So first of all, thank you so much for having us here. Thank you to everyone who made this possible. And thank you to Dr. Mukwege, our 2024 Laureate, for joining us. Look, we're trying not to be a best-kept secret. And so the Aurora Humanitarian Initiative was founded on behalf of survivors of the Armenian genocide and in gratitude to those who saved them. We do that through a $1 million prize that gets given to a local humanitarian doing incredible work on the ground, for example, Dr. Mukwege, who we see as the spiritual descendants of those who did that work for our ancestors. I use the term our, my name's Armine, right there in the name, I'm Armenian. And for me, the story is of 2 German soldiers who disobeyed direct orders to pull my great-grandfather and his brother off of a train to a desert march. And their descendants are out there somewhere, and they probably don't know about that, but I know that, I feel that. So there is actually a broad constituency for this, because that's my story, but in this room, we have untold, unfortunately, descendants of those who suffered other atrocities and traumas and who have survived in other ways, whether that is of disease or oppression. That is an unwilling diaspora. I'm a member proudly of one diaspora. I'm an unwilling member of this diaspora. But what that diaspora knows deeply is that while you can't control what has happened to you, you can control, and well done to the Clinton Global Initiative on your theme, what happens next. Aurora is all about that. And so by honoring the spiritual descendants of these people who helped us exist, we really try to continue gratitude in action.
Dr. Mukwege, you are recognized as a leader, as a hero in the work that you do kind of with the Pansy Hospital. I think one of the reasons you have so many people who so admire you is that you've just never given up. You just continue to provide care to especially the women who need it most. Can you share about your work now over many years with Pansy Hospital, and also what you want people here to know about that work going forward?
Thank you so much, Chelsea. Thank you, Armine, for giving me this opportunity to share about Pansy Hospital. Pansy Hospital, his history is really the adaptation history, because when I sought to build this hospital, to fund Pansy Hospital, my idea was to get a place where a maternal health care, where really women can be safe, because in my country we have the highest mortality of maternal mortality. And this was shocking me to see that it's not happening in many countries, but when you are in a country, a war country, women are paying really a lot. And I think that I could get a place where really to perform a C-section is not a question. So, but unfortunately, the first patient I treated at Pansy Hospital, she came because she was raped with extreme violence. I have never seen something like that before. And I was just thinking that maybe it was done by someone, a madman, and who just lose his really. And, but at this moment, after 3 months, I discovered that I've already treated more than 45 patients. There I start to think that this is really very new. It's a new pathology in our area. So I adapted the hospital to take care of victims of sexual violence, but treating them medically, after a few years, I could see that it was not enough. And especially I can remember women, we treat her surgically, and it was really a success, if you can say, on the surgical side. But suddenly she refused to eat, she refused to talk, and talking with the family, I could understand that the question was, she was raped in front of all his family, and she really could not accept this to go back home. And there we start to understand that our surgical treatment was not enough. So we introduced also the psychological support for victims of sexual violence. And this was the first time in Congo to get psychologists in the hospital. Wow. So slowly, we add also socioeconomical support. And what I found really, sometimes we have impression that women are asking justice because they want reparation, they want to get something. But our experience is that really, for victims of sexual violence, to ask justice is more about their dignity. They want to be recognized as victims. So now at Panzi, we have 9 lawyers who are there to support women and to accompany them to the court if it's needed. And I think that our really capacity at Panzi is to try to do the adaptation when the situation comes. Now, with the data of OCHA, we have in July, the data show that more than 100,000 cases of sexual violence and gender-based violence in the DRC. This, if at the end of the year, maybe it will be the double. And if it's double, it means that we'll get 2 women one woman will be raped each 2 minutes. And there, of course, we need to get a strategy. And at Panzi, we have a strategy. One is to use a mobile clinic so we can send our team to go to meet patients, so patients have not to travel, because in traveling, they're taking risk of security, but also we need to feed them, we need to take care of them at the hospital, and the hospital don't have enough places to take care of them. So we have this mobile clinic we are supporting. And the other idea that we have now is really to try to get small we are calling them one-stop centers, the place where women can receive all the treatment that they can receive at Panzi without being obliged to come to Panzi. It's a way also to respond to this crisis that we are going through in DRC now.
Well, thank you. And I'm so struck by your framing that the story of Panzi has always been a story of adaptations. We're certainly in a moment, as we heard from the prior panel, whether looking at the kind of NGO sector, or the advocacy sector, or the multilateral sector, the real retrenchment of resources is having cataclysmic effect on being able to provide direct services, especially in particularly fragile places. And I think makes, Armine, the work that you're doing to highlight the people who continue to be called into these moments just all the more powerful. As other donors back away from the humanitarian space, how are you at Aurora thinking about your mission? How are you trying to expand the circle of gratitude so that there are more people who maybe historically haven't thought of themselves as kind of part of the humanitarian network, feeling not only like, yes, like we would like you to join us, but also this too could be a way to manifest your mission. Just how are you grappling with all of that?
A light one there. Look, Aurora's all about the human in humanitarian. We always have been. We're about telling stories that make it easier for people. And I'm not talking necessarily about the people in this room. You understand the stakes. You've expressed interest in humanitarianism. It's not the folks that you're talking about maybe don't think that way. Help them turn toward crises that might otherwise be easier to turn away. A lot of what you were saying, Dr. Mukwege, it's difficult to hear. But hearing your story of adaptation and perseverance makes us turn toward, helps us understand. And so I think crucially bringing it back to the human and humanitarian, casting a wide net of who can be included in that. And with what I was mentioning earlier and what you heard from Dr. Mukwege, those adaptations, those strategies are best deployed, are best understood by those who are proximate to the issues. So for us, the way the prize works is that the individual receives a portion of the award, and then we say, you're in the best position to deploy capital, full stop, and to uplift communities around you and around the world. And so at a time when people are pulling back or pulling out, look, it's difficult to prove a counterfactual, but we have had, again, an unwilling front seat to the cascading effects of these drawbacks. The good news is the human in humanitarian implies also a humanitarian in every human, in every one of us. And so here you have a doctor humanitarian, you might have a teacher humanitarian, an activist humanitarian, a Renaissance woman humanitarian, if I may. And if we, again, build that coalition, build that constituency, bring more people in, and by the way, if anyone is interested in getting into the space, we would love to speak with you. I think that way we can start to combat some of these cuts, at least on a, again, proximate local level.
Dr. Mukwege, one of the things I so admire about Armine and kind of the Aurora Humanitarian Prize and initiative is what she just said. You know, really investing in people that are proximate or on the front lines, you have lived experience, whatever the words we use are, but I think really for all of us, at least here, just understanding that the best people to solve a problem are those who likely are living through it. You know, Dr. Mukwege, what would you want anyone here to know, or who might be, you know, joining us on live stream to know about how you think organizations who are funding organizations, or organizations that are direct service organizations, or organizations that are advocacy organizations, but organizations that aren't Pansy Hospital. How best can people support you? How best can organizations support you in a way that doesn't increase any burden on you to serve them, but really enables you to serve the women and girls who are so dependent on you and your extraordinary staff to save their lives, their health, their livelihoods?
Yeah, thank you. Really, I think that the way that, if I can see what you are doing, you are on the front line. For example, now I'm here, I can't go back because I was outside of Pansy, the hospital, when the war started, so I don't have capacity to go back. But what I know, my staff is working very hard to reach out patients who are in the remote area, in rural area where people are fighting, but they are victims. And I think that the most important thing is really to build or to get a kind of trust-based approach. Because when you have this trust-based approach, you have organization on the ground, you trust in them, you have a long-term collaboration with them, so you can communicate in a way that you give them opportunity to do what they have to do, because sometimes we have deadline, and this deadline don't take consideration about the situation on the ground, and the staff can be really in situation of stress because they must give a report and so on. But when you are treating patient in this condition, sometime you can plan to go to, for example, the mobile clinic, to go in some place. But if you can't go there, it don't need that people are not in need in this place. Maybe you can do it later. But for many organizations, if you come late, then you can't really receive the grant or the support that are coming from them. And I think that the only one way really is to build this confidence, to build this trust-based approach, so with the organization on the base. And I think that we are really very happy that with Aurora, we are trying Pansy, Heal Africa, and the Sofapadi, trying to work together so we can support more victims of sexual violence. Now we know that the number is very, very high, and we need to get a strategy. We need to get a way to support victims of sexual violence. And I think that creating this commitment that we are going to launch this week with these three organizations is a way for us to get a big impact, to treat more patients. And I think that really I'm so proud that we are going to do this commitment this week.
Well, we are proud and honored, Dr. Mukwege. I, in our last few minutes, want to just ask each of you how you're thinking about, and then how you would like the community here to think about and engage on ensuring, Armine, something that you said earlier, people are not turning away. I think we heard from the earlier panel, there are 300 million people that are in kind of what any definition of humanitarian crisis would entail. We know that there are probably 20 million people in the DRC that are kind of part of that number. And yet we know here, at least in the United States, and I wouldn't speak for kind of what may be known outside the US, but here in the US, we pay very little attention to the DRC. We also pay very little attention to Sudan, which has the largest humanitarian crisis of our time. Armine, how are you at Aurora, not only looking to kind of ensure that our discomfort or disinterest doesn't have us looking away from humanitarian crises, but instead our common humanity has us looking kind of toward them and asking ourselves what we can do, but especially for places like DRC or Sudan, where there's anemic attention at best.
Heard someone say earlier this week, if someone comes to you saying they know exactly how to break through in this media environment, run. Run in the opposite direction. It is an incredibly difficult environment. The attention economy is a tricky one, and our time and resources collectively are scarce. Does not help that forces are making those even scarcer. The way that we think about it really is the human in humanitarian and the humanitarian in every human. The first, making it easier to turn toward, and the second, calling to action everyone who feels that pull, whether it is because they're a part of the unwilling diaspora who have been affected by these types of atrocities, or whether it is because you see your child in another child, or frankly, whether it is you run into the fire because you know fire spreads. Whatever it is that brings you to this work, we want to bring and retain and again, open up the umbrella to everyone. You mentioned Sudan and overlooked conflicts, and so I'll share earlier this week, and you were part of selecting them, Chelsea, we named the 2025 Aurora Prize finalists. Looking to the future, that is currently our biggest funding vehicle and kind of how we shine a light. 2 of those 4 work in Sudan and South Sudan. And the others work in a number of conflicts around the world. When we shared these finalists, we were able for the first time to bring them together on video, which we hadn't been able to do in the past. And the thing that gave me hope, and again inspired me looking to the future, was seeing organically the 2 humanitarians speaking to one another and seeing each other in the other. Hadn't met before, but in understanding each other's lived experience and understanding the tools, the adaptations, the strategies, feeling community. Showing that to a broader audience, I would hope that others feel inspired to jump into.
Dr. Mukwege, really, want to give you the final word. What more do you think we can do to support your work, also to help more people know about both the ongoing conflict that's preventing you from returning home in the DRC, and also the really vital work that you and others are doing to ensure that people in DRC are able to access the services that we would hope for any of our children or ourselves anywhere. What should we know, and how can we try to be supportive?
Yeah, I think that for the DRC, it's really very important that people can support you know, DRC is a forgotten war and a neglected crisis. And without really to get media on this crisis, without the political will, and of course, humanitarian support, but all these three things are going together. So if humanitarian organization can support more, not only in supporting on the humanitarian side, but also giving information, trying to bring, to highlight the situation on the ground, to work with organization or leaders on the ground and bring all this information at the media. I think that this can help also political leaders to don't be indifferent. And if they are not indifferent, so I think that it's a cycle. There also the humanitarian support can be better. So I think that what really I can ask today is, please talk about Congo. It's more than 6 million people killed. Millions of women are raped. And even when we are talking here today, I don't have any news about one of our one center in Mulamba, what happened with my staff and patients. So if you don't talk about it, people will go on to be killed, raped, without an end. Thank you.
Dr. Mukwege, Armine, thank you so much, and I hope everyone here very much takes Dr. Mukwege's words to heart, but also into action. Thank you all. Thank you.